it's on. Hello. So, basically this portion is for the treatment of mental disorders timeline, which basically is just going to really briefly touch on the how the treatment of mental disorders has developed since ancient times, pretty much. So, here we go. The very first actual evidence of an attempt at treating mental disorders or any other kind of problem in the brain was trephination, which can be the earliest examples of this could be dated back to 5000 BCE. Trephination is, essentially is when they drill a hole in the... this camera is crappy. There we go. In the skull, like that. And back in the ancient times they did it because they thought there was evil spirits in there that needed to be released in order to fix the problem. Now it's more used to relieve pressure on the brain caused by fluid buildup or other injuries to the brain. So that was your first example of what they did. As I already basically mentioned, the whole idea of mental disorders were being caused by evil spirits or were blamed on other supernatural phenomena at this point. Trephination was used as a very, very, very common way of trying to fix the problem because they thought they would release the bad things from the brain. And also at this point, the Persians came up with the idea of if you have a problem in your brain, you're not clean enough, you're not hygienic. So their idea of fixing the problem was trying to make somebody have better hygiene, if there was a such thing as that back then with anybody. And the ancient Egyptians encouraged more recreational activity as a treatment for mental illness, so maybe they thought you were just being lazy and that was making you go crazy. I'm not quite certain how that was supposed to fix anything. Excuse me, sorry. So here's an interesting thing. By the 5th to the 3rd century BCE, the Greeks had already figured out that mental illness is a natural occurrence and were trying to change the view of mental illness. Hippocrates suggested the four humors theory of medicine, which basically covered all kinds of illnesses, and blamed them all, including mental disorders, on a imbalance of the four humors in the body. So at this point, treatments changed from just trephination of the skull to using purging of various kinds, including bloodletting, to try to fix the balance of those humors and fix the illness. So for mental illness treatment, at this point, you would be using these fun little guys. This is a leech. The species is actually called a medicine leech because this is one of the most commonly used species in for medical purposes. And yes, they are still used for medical purposes now. However, they're not used for bloodletting like what the Greeks were originally using them for. It's more like if you have like a really bad black eye, they'll attach a leech there and it will take down the swelling because it will help drain that broken blood vessel stuff that I'm having trouble coming up with at the moment. It helps to bring down the bruising so you're not all swelled up, basically. It's one of many alternative medicine things that are out there. Kind of disgusting to have a slimy worm on your face, if you ask me, but whatever floats the boat, I guess. And then also environmental or diet changes were also supposed to fix it at this point as well. However, I'm not so sure how that did any good, because basically all they were doing is draining people's blood, and yeah. Anyways, the interesting part of this is that nobody else really seemed to catch on to this, because around the time of the 1400s to the 1600s AD, fast forwarding here, mental illness was still being blamed on supernatural causes, such as demons, Satan, witchcraft, stuff like that. This era also brought about things like the Salem witch trials, where people were being prosecuted for things that weren't necessarily magical in nature. So this, from the 1400s to the 1600s, you saw a lot of witch hunts, you saw a lot of people being burnt at the stake, and not a lot of attempts at trying to find out exactly what was causing the problem to begin with. And this was all sicknesses, it wasn't just mental illness, but mental illness was a huge part of it, because it makes people act different than what's considered normal. By the 18th century, everybody seemed to have settled down about the big hysteria about the witchcraft. However, they did bring into play mental institutions, also known as asylums, and those were very commonplace back then. However, treatment of the mentally ill at this point was absolutely, I mean, not even, I don't even have words for it. They basically put you in this dungeon-like room, chained you to your bed, and then left you all by yourself there. They didn't try to actually fix the problem, they just tried to lock you away so nobody else had to deal with you, which was actually kind of not okay at all. However, they didn't figure this out until the late 1700s, when people like this guy, a French physician by the name of Philippe Pinel, finally saw the light and started trying to advocate for better treatment of the mentally ill. In 1795, Pinel actually managed to prove to the medical community that more humane treatment of the mentally ill actually was beneficial for everybody, because at this point, because there was so many asylums and such an influx of people with mental problems, there was an overcrowding problem. So he took it upon himself to sit down and start talking with patients and trying to figure out what exactly was going on with them and trying to help them. And consequently, they were starting to leave the hospitals faster, whereas before they were staying for months and months and months and years on end and weren't being allowed to leave because they weren't improving. As he started doing this, they started improving and leaving faster, so that showed that there was more of a benefit to treating them properly. Moving forward to the 19th century, this lady also was advocating for better treatment of the mentally ill as well, Dorothea Dix. And she also brought about more improvements, because even 19th century was the 1800s, so that's Victorian era. You didn't want to be in an asylum at that time. It was not good for anybody. I mean, it was much improved to the very first asylums, however, they still were basically torture chambers for people. It wasn't you might as well have been a prisoner for the way they treated you as a mental patient back then. So Dorothea Dix did bring about a few more changes to that, and had a hand in significantly improving things, as I understand. Fast forward again to 1917, and you have general paresis being recognized as one of the first real mental illnesses acknowledged as an actual problem. General paresis essentially is essentially is when the syphilis syphilis affects the brain and nervous system and causes psychotic behavior. However, the treatment that was introduced at this time for germ paresis was malaria therapy, which is exactly what it sounds like. To try to treat the syphilis, they would infect a patient with malaria, thinking that the fever would somehow fix the problem. However, it really didn't work very well, because all you're doing is introducing another sickness and making people sicker. In the 1920s, narcosis therapy became a pretty commonplace thing. Which basically was a chemically induced coma. Sorry, my train of thought just disappeared on me. Narcosis therapy. Oh yeah. So basically, narcosis therapy was a chemically induced coma accompanied by an attempt at psychotherapy. And by the 1930s, things like narcosis therapy and chemically induced seizures became a very commonplace form of treating mental disorders. And in 1938, the first electroconvulsive therapy was introduced, and eventually that replaced chemically induced seizures. In the 1940s, lithium was introduced. Actually, originally it was introduced as a salt alternative for patients who could not have actual regular salt. However, it started killing people because it was not the amount was not regulated. So they stopped using it as a salt substitute, but eventually realized that for bipolar, in small amounts, it was beneficial. So it was brought into play to treat bipolar disorder instead. Eventually. And in the 1950s, I can't talk. Paraldehyde, or a chemical straitjacket, was the most commonly used drug in mental facilities at the time. Basically, it's called a chemical straitjacket. It was a sedative and subdued people. It didn't actually fix anything or control anything. It just basically got them out of the way. Kind of like the original way people were being treated, but just get them out of the way. We don't want to deal with them. Also in the 1950s, I can't read my own stuff here. Also in the 1950s, I lost track of my thought again. Oh yeah, in the 1950s, phenothiazines, also known as your narcoleptic or antipsychotic drugs, were starting to come into play. In 1955, a drug originally used to treat tuberculosis was aided in the discovery of your MAO inhibitor antidepressants. In fact, this tuberculosis drug became one of the first MAO inhibitor antidepressants used. It didn't do a very good job against the tuberculosis, but it did really well for treating depression symptoms. So yeah, it was basically discovered by accident. In the 1960s, the most common treatment for the mental problems was electroconvulsive therapy, and it wasn't very perfected yet, so this was a very uncomfortable treatment, as far as I understand. I've never had to deal with it, so thank goodness, but And fast forward a little more, and you have in 1987, Prozac was introduced, which brought your selective reuptake inhibitors into play. And that basically brings us to the present with better treatment, like community health centers and psychiatry, and one of the most important things right now is that treatment is voluntary. You can choose to be treated rather than just being thrown into a dungeon, essentially, which was originally how things had ended up, if you showed any kind of psychotic behavior or whatever. And now we have laws in place so that the things that were originally being done, which were basically unacceptable, won't happen anymore. So in other words, things are a lot better now than they were back in the 1700s when things were just starting to be recognized. And that's all I have for this particular part, and I will continue on the next one.